For too long, our healthcare system in the United States has been organized around the needs of healthcare institutions like hospitals, healthcare professionals like clinicians or health plans, and not around the needs of patients or members or consumers. We know that patients who are more engaged in their care are more adhere to their physician's advice. They take their medicines more regularly. They're more likely to engage in wellness activities. So actually empowering and engaging patients or consumers actually will both promote better health and over the time, I believe, save money. It is going to be an interesting and confusing time because on the one hand, we are trying to coordinate more and give our members a more coordinated, seamless experience. On the other hand, there are a lot of disruptors coming into the system wanting to support patients on a piece of their journey, and we're going to have to find ways to work with them. And so I think one of the concentric circles outside of health plan, member, and physician or hospital are going to be a lot of information providers that can bring in a particular either skill or capability that we may not have or they may deploy better. I think you can expect that the big global companies like Apple and Google and Amazon are getting very interested in healthcare. They're going to be in this space. We have to figure out ways to work with them. I'd like to say that the consumer is going to own the consumer, that we have to actually put the consumer in the middle, kind of in charge of their own experience. And I don't think anything less than that is going to be acceptable. And so they don't want to be owned by their health plan or by their physician practice or their hospital, for that matter, by the big technology company. I think they want to navigate and kind of create their own experience. And I think it's going to be different for different people depending on their preferences, depending on their age, depending on their illness burden. And it may change over time, over life. And so I think the best companies like ours are going to have to be flexible and agile enough that we can respect that many of our members are going to have different ideas about what that experience is and to what extent they want to own it.